Hi, uh, good afternoon. Today we are going to talk about IBS and IBS in children. IBS is very common in adults. Always we have seen that everybody says, I suffer from IBS. I have some IBS with constipation or with some diarrhea. But in pediatric, it's not that common. It is classified as one of the functional gastrointestinal disorder with pain. And when we cannot level this as IBS or childhood migraine, abdominal migraine kind of thing, or any other disorder or functional dyspepsia, then we classify it as functional abdominal pain without uh, otherwise not specified. But the problem is that when we are labeling them as IBS, IBS is really not very common. Most of the IBS, what we get it, they usually suffer from functional constipation. When we cure the functional constipation, the basic word IBS actually gets cured. The pain disappears, and we cannot label them anymore as irritable bowel syndrome. But there are certain population, like adolescent population, when their life is little bit struggled, or they had some early life event, or they had some trauma or stress, and then they often suffer from irritable bowel syndrome, and that is usually might be overlapped with constipation, but usually not, but can be associated with constipation. And then we have to specifically treat that irritable bowel syndrome with different mode of treatment. We have some mode of treatment, but nothing is like super active or very effective, as we know, and this is applicable also to the adults. And in pediatric, what we try best is we give them enough time in our OPD, the first step. Second step is that what we do, we sometimes add some probiotics. Sometimes we test them for the small intestinal bacterial overgrowth, and if we treat them, they get much better from their symptoms. And third is that we sometimes combine this with cognitive behavioral therapy or hypnotherapy, some mode of psychological therapy along with this. So that ultimately relieves quite an extent. But obviously, we have to know that this is a brain gut axis problem, and whenever brain gets disturbed, the symptom might recur or it can come back the same way. And then again, also we have to treat the same way how we have already established a particular treatment for a particular child. And it is often individualistic, and we have to take an individualistic decision for individual IBS, how we will approach those patients and how we will treat them individually. And approach should be actually personified. So that is my today's main instruction to the adolescents and to the parents whose children are suffering from irritable bowel syndrome.